Hi, this is Dr. Jarrod along with Midwest Low Vision. If you've been told you have Fuchs Corneal Dystrophy, or even just guttae or corneal guttata, you're probably wondering three things. First, how serious is this? Will it get worse? And what can actually be done about it? So let's clear that up. Fuchs Corneal Dystrophy is a progressive disease of the cornea. Specifically, it affects the endothelial cell layer. These are the cells responsible for pumping fluid out of the cornea to keep it clear. When those cells start to fail, fluid builds up, the cornea swells, and vision becomes cloudy. You may also hear this called Fuchs endothelial dystrophy, or simply Fuchs disease. Same condition, different wording. Fuchs is genetic. This is not something you caused. It's not related to screen use, eye strain, or anything you did wrong. The endothelial cells decline slowly, often over decades. Symptoms usually appear later in life, but the disease process often starts much earlier. The most common symptoms are blurred or hazy vision, especially in the morning, glare and halos around lights, vision that fluctuates throughout the day, and in more advanced stages, eye discomfort or pain. If your vision is worse when you wake up and improves by midday, that is classic Fuchs. So let's answer some questions. Just how serious is it? Some people live their entire lives with only mild Fuchs and never need surgery. Others progress to significant corneal swelling that interferes with reading, driving, and daily activities. This condition of your cornea exists on a spectrum. Where you fall on that spectrum matters. Let's do a brief treatment overview now. So early treatment focuses on managing corneal swelling. So not curing the disease, that may include hypertonic saline, salt, or sodium chloride drops and ointments, morning evaporation strategies such as using a hair dryer on low, yes, blow drying your corneas, and dry eye management possibly throughout the day. When vision becomes consistently cloudy, surgery becomes the definitive treatment. Modern endothelial transplants, DMEK, DSEK, rather than full thickness transplants, have dramatically improved outcomes for patients with Fuchs. So what are guttae or corneal guttata? If you've been told you have guttae or guttata, that does not automatically mean you will need surgery. Guttae are simply early warning signs and a relatively common corneal finding. They're not a guarantee of progression. How is the diagnosis made? Fuchs is diagnosed clinically. So doctors look at guttae, corneal thickness, and endothelial cell counts. There's no tissue samples, no biopsy. Does it affect both eyes? Yes. So Fuchs almost always affects both eyes, even if one is worse than the other. Is it possible to be diagnosed at a young age? Being diagnosed in your 20s, 30s, or 40s is increasingly common. We're simply able to detect it earlier now, which thankfully allows for better long-term planning. What about morning blur? Morning blur is one of the most recognizable features of Fuchs, but mild morning blur could be normal. The cornea swells overnight and it clears as the day goes on. Is there pain? Early Fuchs is usually not painful in any way. Pain tends to occur only in more advanced stages. So what about salt drops? Well, as mentioned earlier, hypertonics or salt drops can help reduce swelling and improve clarity temporarily. They relieve symptoms, but they do not stop progression. What is surgery recovery like? Well, recovery after modern endothelial transplant is generally much faster and way better tolerated than older corneal surgeries. So many patients notice improvement within weeks, with continued refinement occurring over months. How about Fuchs and cataracts? Well, Fuchs and cataracts often occur together, both being rather age-dependent. Cataract surgery stresses the endothelial cells, though. So this is why many patients benefit from combined procedures when appropriate. Finally, how does low vision care fit into this? Now, here's something that simply doesn't get talked about enough, in my opinion. Most people do very well after Fuchs surgery, but not everyone ends up with perfect vision. Some people are left with glare, contrast loss, or other visual limitations that can still affect daily life. This is where low vision care fits in. So at Midwest Low Vision, we help patients function better, even when the eye itself or eyes can't be fixed any further. So if vision problems are still limiting you, it's worth knowing there are options beyond. You just have to live with it. Thanks for watching, and I hope this answered some of your questions about Fuchs corneal dystrophy.